Hello everyone, welcome back to my channel. This is Learn and Move with Kalani. Today I'm going to dive into an interesting as well as an important topic in sports physical therapies, that is treatment of muscle injury. Under that, I'm going to talk about the rehabilitation and recovery strategies following a muscle injury. If you are a sports physio or someone dealing with injuries, this video is for you. Make sure to like this video and subscribe if you find this content useful. So, let's get started. In this session, I'm going to talk about muscle injury healing principles, rehabilitation strategies, and practical applications for sports physios. First, let's look at different types of muscle injury. Knowing the type of muscle injury helps us to plan the best treatment approach. There are four main types of muscle injuries. First one is laceration, where cuts or tears of muscles occur. Second type is contusions. It may be muscle bruises in the contracted or relaxed muscles. Third type is strains, where the overstretching or tearing of muscle fibers occur. Finally, we have overuse injuries that includes tendon involvement and delayed onset of muscle swelling. There is a quick tip for this slide. DOMS, or delayed onset of muscle soreness, is sometimes debated under overuse, but it results from excessive or unaccustomed load. Muscles heal differently than bones. Unlike bones, which undergo a repair process such as fracture healing, muscles rely on regeneration, but often with some scar tissue formation as well. So, what are the key differences in muscle and bone healing? In bone healing, it undergoes pure healing process such as callus formation. But in the muscle healing, it undergoes regeneration plus repair, where the scar tissue formation that can function. Now, let's break down the three phases of muscle healing. Understanding these stages help us to tailor our rehabilitation process. First phase is the inflammatory or destruction phase, which goes from 0 to 7 days. In this particular phase, rupture and necrosis of myofibers take. In addition, clot formation and inflammatory reactions also occur. Second phase is the repair phase. It goes from 1 to 4 weeks. In this phase, phagocytosis, where the removal of dead tissue occurs, and myofiber regeneration and scar tissue formation also take. Finally, remodeling phase takes place that goes for 4+ weeks. In this particular phase, maturation and reorganization of the muscle fibers occur, and scar tissue contracts to allow better function. So, what's the clinical tip? Loading too early in the inflammatory phase can increase scarring, but avoiding load for too long can weaken the muscle. These few pictures show the process of skeletal muscle healing. This brings us to an important concept, that is mechanotransduction. This is how our muscles respond to mechanical load and adapt over time. Before that, let's have a look about the optimal loading. As we all aware, optimal loading can be defined as the load applied to structures that maximizes physiological adaptation. Achieving optimal loading is challenging, but should be driven by variables such as the tissue type, pathology, and the required tissue adaptation for eventual activity. Specific loading goals may include increased tensile strength, collagen reorganization, increased muscle tendon unit stiffness, or reorganization. How do muscles respond to load? It is something like Muscles can turn the movement into repair. Actually, there are 3 steps of mechanotransduction. First step is mechanocoupling. It is the stage in which external load triggers an internal biochemical reaction. Second stage is cell-to-cell communication. In this particular stage, the signals spread through the muscle tissue. Finally, gene upregulation. In this particular stage, DNA instructs cells to produce proteins to promote muscle repair. These few pictures shows the 3 stages: mechanocoupling, cell-to-cell communication, and finally gene upregulation. Okay, now let's go for an example. Nordic hamstring exercises stimulates integrity, which send repair signals to the muscle. This nucleus is then signaled to create amide, and these ribosomes create proteins, and this collagen extrudes from the matrix. Our main rehabilitation goals are simple but crucial. There are 3 main goals during our rehabilitation. First one is restore function, minimize reinjury risk, and optimize sporting performance. What is the key insight? Rehabilitation is not just about recovery, it's about building resilience and prevent future injury. Rehabilitation happens in stages. Let's go through them. First stage is the early stage where we have to deliver isometric exercises in pain-free activation, and we have to manage inflammation such as pain. In the mid stage, we have to have eccentric loading where we have to undergo gradual strengthening and neuromuscular control. In the late stage, we have to focus on functional movements, plyometrics, and sport-specific training. For an example, if you consider the hamstring injuries, by introducing high-speed run at the right time prevents future injury. In addition, here's how we ensure rehabilitation is effective and backed by research. The evidence-based strategies proposed, we have to follow the L protocol, which is the lengthening protocol following a hamstring strain. For an example, it includes 3 exercises, 3 types of exercises. First one is the extender, diver, and the glider. The extender has to be done every day, 3 steps of 12 reps, while the diver should be done every other day, 3 sets of 6 repetitions. Finally, the glider every 3rd day, 3 sets of 4 repetitions. The pillars of hamstring management includes high-speed running, trunk control, neuromuscular control, force to velocity capability. Whereas calf injury return to performance pathways include developing calf strength, developing explosiveness, sport-specific activation, and endurance capacity. We have to follow the evidence-based progression, such as if the pain worsens, we have to go back to the step. The step. Then when palpation length of the pain is 1/3 or halfway better, that is, we consider we are successful in that particular rehabilitation process. Then maximal hip flexion and active knee extension is best flexibility measure but normalizes by 50% recovery. Finally, outer range strength is best measure and guide strength progression. So let's go back to the takeaways of this presentation. Early loading promotes better healing. Rehabilitation progression should be criteria-based and not time-based. Training through injury with modification leads to better recovery. So what are the final thoughts? Rehabilitation is not just recovery, it's performance enhancement. Now let's discuss some key questions. Feel free to drop the answers in the comment. First question, why is early loading beneficial? Best indicators for return to sport readiness. Explain them. What are the common mistakes in muscle injury rehabilitation? In addition, I have put some MCQ and SCQ questions for your reference. For MCQ questions, I have marked the answer here. These are really simple questions. They are just from my own presentation, such as if you consider which phase of first question, which phase of muscle healing involves phagocytosis and tissue regeneration? It's obvious. Tissue regeneration and phagocytosis occurs in the repair phase. Then what's the key concept behind the mechanotransduction? It is the gene upregulation. And finally, which of the following is not an evidence-based rehabilitation exercise? Following a hamstring strain, it's hamstring curls because extender, glide, and diver. All these three exercises are coming under hamstring strain rehabilitation process. And these are the SCQ questions. I will drop the answers for each of these SCQ questions in the comment box. And this actually brings to the end of my presentation. If you have any questions and suggestions, please feel free to drop them in the comment box. So thank you so much for your listening. Hope you enjoy this session. If you feel this session is useful, don't forget to like and share it with among your physio friends. Bye.